Congenital lobar emphysema. What is congenital lobar emphysema? It is a rare respiratory disease in which air can enter the lungs, but it cannot escape. This causes the overinflation of the lobes of the lungs. The upper lobe of the left lung is affected the most often, but it can also affect the middle right lobe. The lung tissue can become very fragile and can collapse. What is going on? So basically what is happening with this is that there's an obstruction of the airway, and that's why the air cannot get out. There are two different types of congenitive lobar emphysema. There's intrinsic, which something from the inside of the lung is causing an obstruction to the airway, or there is extrinsic, and this is caused from something outside of the lung compressing the airway. It could be a structural abnormality, such as a cyst that is pushing on it, and this is causing the airway to be obstructed. Who is at risk for this? It is most commonly diagnosed in newborns and young infants. Some cases, very rarely, but some cases are not detected until teenage years or adulthood. 50% of cases are diagnosed in the first 4 weeks after birth, and 75% of cases are diagnosed before the infant is 6 months old. And males are more likely to be born with this than females. Diagnosis: it is usually diagnosed within the first 2 weeks of life. Is diagnosed by using a chest x-ray, which will show the overinflation of the lung, and you can see that on the picture there. It may also show a blocked air passage. It can also be diagnosed before birth with prenatal imaging, and with prenatal imaging having improved so much, it's more diagnosed like this recently. Signs and symptoms are dyspnea, tachycardia, shortness of breath, wheezing, cyanosis, and enlarged chest. And the enlarged chest is due to the overinflation of the lung. Treatment for this: lobectomy is the main source of treatment. It is basically only treated with surgery, not really medications. If the CLE is discovered before birth, the infant may have the lobe removed immediately after delivery. Sometimes they will do it while they just do like a partial delivery, and the infant is still attached to the placenta so that they are receiving oxygen through the umbilical cord yet. The affected lobe is usually removed within a week after discovery if it's not diagnosed before birth. And the infant will be monitored in the NICU after the affected lobe is removed. Prognosis: depending on the size of the surgery, the infant may only need to be monitored for 1 year. Most infants do not have any issues throughout their life. Once the CLE is treated, they can still have normal lung function even with the removed lobe. And because the surgery is done so early in life, it allows time for the lungs to compensate while the child is growing. A nursing diagnosis for this: ineffective airway clearance related to chronic conditions as evidenced by dyspnea and wheezing. And some nursing interventions: you want to auscultate the breath sounds, assess and monitor the breath sounds and respirations, assess skin color to check for the cyanosis, and monitor vital signs. And those are the sources that I used.